There's a need for more mental health services, and Representative Samantha Vang from Brooklyn Center has a bill to try to help address that need. The bill would work to eliminate barriers to people getting into the mental health field. We spoke to her for today's Newsmakers segment.
Thank you, Shannon, for having me. So my bill, what it does is addresses the mental health needs of the state. As we've seen, COVID-19 has exacerbated the needs for mental health. And for a long time, we've always had a staffing shortage of providers to provide, to support mental health needs. And what my bill does is it will address multiple barriers into becoming a mental health professional, such as supervision. Supervision is often, a lot of clinical trainees and interns have a hard time finding supervisors. And so what my bill does is it provides multiple incentives for professionals to supervise, such as expanding the mental health loan eligibility program, which will expand the number of those who qualify for mental health loan forgiveness to those who supervise, as well as providing supervision grants, which will essentially pay for supervision to clinical trainees and interns. Other provisions of my bill, what it does is it also provides a scholarship grant for mental health professionals continuing to advance in their careers, going back to school, and they can reimburse for tuition, childcare costs, transportation costs. And so those are some of the big proponents of what my bill does to strengthen and increase the number of mental health professionals in the workforce right now.
And it will create a website too that'll be like a one-stop shop for some of these initiatives, right?
Yes, that's correct. I think it's really important. We have such a wide, vast network of resources of what you can do to advance your career as a mental health professional, and so having a one-stop website for mental health providers and professionals to look at what are the resources out there, where they can go and advance their careers, I think will be really helpful for mental health professionals to continue to advance in their careers and really meet the needs of the state.
Sure. And this is something that you're hearing there's a need for, not just here in the urban area, but in rural areas too.
That's correct. All across the state, especially in the rural areas, access to mental health providers has always been difficult. I think, in greater Minnesota, there's multiple barriers such as housing, affordable childcare, that really accumulate and it's hard for professionals to really serve in those areas. And so what my bill does is really trying to encourage and address those needs, and to encourage more professionals to serve in the rural greater Minnesota area. And then we also have communities here in the urban metro area where the reality is 90% of our mental health providers are white. And so we have a diverse population where needs are being met and doesn't really reflect the population of the state. So my bill also addresses underserved communities for communities of color.
All right. Representative Samantha Vang, thank you for being here. We'll be watching to see how it goes.
Find more local news stories at ccxmedia.org and follow us on social media.